All right, thank you so much. Hello and welcome to the Accreditation and Certification Huddle Series. Today we're going to be discussing some best practices and tips to help you ensure that all of your staff are feeling prepared for a survey. My name is Carrie Howard and I am going to be your facilitator today. I am the PATH Quality Improvement Advisor in Minnesota and the Bemidji area, and my friend and colleague Alana Jarman, who is joining us from beautiful Montana today, will be co-facilitating and serving as our chat monitor. This huddle series has been created as part of the Partnership to Advance Tribal Health, better known as PATH, which serves Indian Health Service hospitals across the country. All right, next slide. So this session is actually session 4 of an 8-session series. And thank you again for joining us today. We hope to see you each Wednesday at 2 p.m. Central Time, 1 p.m. Mountain Time. And if you do miss a session, no worries. These are recorded and are available on our PATH website at comagin.org. Next slide, please. I just wanted to take just a couple minutes to talk a little bit about some follow-up from last week's session. Last week we had a little bit of conversation around the current state of surveys by Joint Commission and the CMS state surveyors. And so we wanted to provide this resource. This is a recording from the Joint Commission that was actually recorded at the end of April. And it's really geared, it's a Q&A session that is really geared to the current state of surveys and how that is happening with COVID-19 and the pandemic still in place, though I know we're excited that we're maybe coming to the end of that. But it has some really good information about some of the CMS waivers that have been in place, the infection prevention and control, some of the environment of care and life safety things that they are seeing on the survey, and has some additional live questions and answers. So it's a really good resource for anybody that is curious about the current state of surveys. Maybe you have Joint Commission or CMS that is due to come or overdue to come to visit your facility. All right, next slide, please. So today's session, we're going to be talking about some of the best practices for preparing staff for surveys, including a discussion of some of the common questions that the surveyors ask, and also sharing some examples and tools that you can use for communication and practice with your staff. So after our 30-minute session, we're going to also offer an additional 15-minute open discussion forum. And so during this open discussion, you are free to ask any questions that you have related to accreditation, certification, or PCMH that you might have. And you can enter those either through the chat function or by unmuting your audio line. All right, next slide, please. All right, so now let's get to it. We are today going to focus on 3 best practices for preparing your staff for survey. One is training some staff for specialized survey roles. 2 is creating staff safe and comfortable opportunities for staff to practice interacting with surveyors. And 3 is to talk a bunch about some communication methods and modes, and making sure that people know that surveyors might be coming any day and they're feeling prepared for that. We can go to the next slide and we'll dive straight into our first best practice, which is training staff for some specialty survey roles. So these categories are also described in another resource we're going to share a little bit later, but in our PATH Accreditation and Certification Guideline. But I wanted to spend a little bit of time talking about them today. because they may be new roles to you and your facility. So a couple of specific specialty survey roles that we recommend are creating a command center and command center support, and also utilizing scribes and escorts to actually be with the surveyors as they're wandering around your facility. So first, let's start with the command center support and what that is and what that looks like for your hospital. The command center really is the central hub for direction and coordination. You are probably really familiar with this type of term, as a lot of you were using some incident command structures with the pandemic and the pandemic response. But it is a team of the key people that you need to be, I guess, project managing the survey as it is actively occurring in your facility. So it is the central hub for direction and coordination. The team is actually the ones that you would want to be compiling all of your documentation that's requested by surveyors. So while they're out and about within your hospital, they are often asking for policies or employee files or specific documentation that they need to do their review. And one of the key things we want to be telling all of our staff, a standardized response to those requests is we will get that through our command center support. So we don't want frontline staff to print and produce those documents on their own, but to be able to respond in that standardized fashion, and then also for the command center to be ready for those requests as they come in, so that by the time surveyors are done with their direct observation and ready to go back to their conference room or their home base for the survey, they have those files readily available. Another key role of the command center support is to be disseminating real-time information to all of the facility leaders and the staff. So as surveyors are moving to the next department, as they are asking for the same questions in every department, those kinds of things, as we go through the survey, having this structure in place and having this centralized communication process is really, really helpful for you to be able to address, share information, but then potentially address some of those issues in real time. So as you may know, surveyors, if they find something in one department, they are often going to be looking for the same thing in the next department. So this structure allows you to make sure everyone does one more environmental sweep and looks around their area to make sure that they can address those things in real time. Shifting gears a little bit, the scribes and escorts role is a little bit different. So where the command center is usually parked in one office or one conference room or location, the scribes and escorts are really the people that are paired with each surveyor, walking around, guiding them around the building and the campus, but also taking those real-time notes and feeding that information back to the command center. And so some of the key notes that are really important to share with the command center is the name and role of any staff members that are directly interviewed. Oftentimes those are the staff member files that they want to take a look at. Key and frequent questions that they are asking. So again, being able to share that in real time so people are feeling prepared for the types of questions that are being asked. Again, those requests for policies and documents. So you have a little bit more time to respond and get those prepared and handed to the surveyors in a timely fashion. And also to make sure that you're documenting any items mentioned as areas of concern, or if you can just kind of feel that the surveyor might be zeroing in on a specific finding or area of risk, to share that information in real time, because you can start talking about how you might want to address those things even before the surveyors are out of your building. All right, next slide. So the next component we want to talk a little bit about is communication. So the next best practice when we're talking about preparing staff for survey is our communication tools. So there are two resources that the PATH team has prepared for you. These are one-page overviews of Joint Commission accreditation and the Joint Commission PCMH certification that include some high-level information about what it is, why it's important to staff and patients, and then also has a section about what is expected of staff to support and attain and maintain accreditation and certification. These are, again, really high level, but can be super helpful to use as you're nearing your survey window, to use as handouts or flyers, post them in your break areas, in your bathrooms, your staff bathrooms, those kinds of things, so that people are both aware that the survey is coming and then also aware of at least the basics of what the accreditation or the survey is about and what they should be prepared for. And with that, if we can go to the next slide, we have another example of a communication tool from one of our IHS hospitals. And I would like to invite Veronica Speller, quality manager at the Red Lake Hospital, to come off of mute and share a little bit about her Espar Bites newsletter. I really like this newsletter approach and really especially appreciate that she integrated the TeamSteps Espar communication tool. And she created this series that includes some great information and tips on an upcoming facility conversion and survey, some of that basic survey preparedness. And she has also kindly made this available on the IHS quality portal. So all of you can access that through the portal. And with that, I'm going to hand it over to Veronica to say a little bit more about her newsletter series. And we can take a little bit of time too. If you have specific questions for Veronica, please feel free to enter those in the chat.
Can everyone hear me?
We can.
Awesome. Hi, this is Veronica Speller. Thank you, Carrie, for that introduction. And as she stated, I am the quality manager here at the Red Lake Hospital. And the reason that I created the Espar Bites was because I thought about a way to establish communication with the staff. And I remember a mentor that I had, she shared an analogy with me regarding tackling big tasks, or like eating an elephant. You do it one bite at a time. So I know that Joint Commission preparation and sustainment is definitely a huge task. And I wanted to break those huge chunks of information down into smaller bites for the staff. And so I created the Espar Bites to use as a tool to communicate the information to the staff in a consistent manner in order to increase and provide transparency, awareness, and to support our TeamSteps program here at the facility. And so I send this information out to the staff on an intermittent basis. It's sent out to all staff. And I've also had some feedback from the staff, and they have requested certain things to be added to the newsletter to be put out to the staff. So they have been very receptive of it. I've received support from my leadership team as well. I think the biggest positive thing about it is the consistency and the communication. And so if they have questions, I try to keep it to one page and try not to give them too much information at one time so that they can post it in break areas or wherever they would like to post it. And they'll also use it in their huddles to have a formable communication tool that they can use to disseminate the information to their teams all at one time who may not have access to the information as soon as it comes out.
That is so great, Veronica. Thank you so much for sharing. And I am especially impressed and excited about the fact that you are getting specific requests from frontline staff members about topics or things that they want to know more about. That is so encouraging, and just really, really great news.
Thank you.
I haven't seen any specific questions in chat come through, but I do just want to pause just a moment to see if anybody has specific questions for Veronica. And if you don't have any now, that's okay. We have some time in just a bit to come back to some discussion and open questions as well. Well, just pause just in case somebody's typing as I speak. All right, I did see Alana added one question that is asking if any of the other organizations, anybody else on the line, if you've done anything similar to what Veronica has shared with her Espar Bites. And again, please feel free to answer in chat. And I don't see any other questions coming in, so I think we will then move on to our last best practice. And you can go to the next slide, Jonathan. And now we are actually going to put you on the spot, and we're going to practice ourselves in real time. And so I want everyone to be prepared to actively participate using the chat function. I'm going to ask a few questions, and Alana is going to help us by reading out the responses as they come in. So just prepare, get yourself in front of your keyboards, be prepared to use that chat function. And we are going to take these questions one at a time. In my experience, I worked for quite a while at a couple of different large health care systems in the upper Midwest here, and spent a lot of time with surveyors. I served as a scribe for many years. And these are some of the top key basic questions that I heard pretty much asked of every single employee that they interviewed while they were on site. So hopefully you are ready to practice, pretend that you are being interviewed by me in your survey. So Jonathan, you can click the first one and we'll take these one at a time. So the first one is, what quality improvement project are you working on? We'll just give folks.
We have self-management goals, patient experience. And we did have a few people respond earlier to that question, Carrie, too, regarding some of the newsletter stuff. So Blackfeet Service Unit has one for night shift, and then also PRSU has sent out survey tips, but not in a format like this. We're currently working on hand hygiene, self-management goals, health literacy. Jennifer Moore, no waiting room, no wait waiting room. Took me a little bit to read that one. Patient satisfaction, diabetic foot exams, customer service, patient satisfaction. We also have PCMH for empanelment, access to care, and patient satisfaction. Many within the PCMH project. So that I think there's a lot of PCMH going on.
Yeah, great. And you guys did a really good job of responding right away. I know it's a little bit different when you're chatting in versus being face-to-face with a surveyor. But yeah, this is very encouraging to me that people know what they're working on. Oh, I am so sorry. We live in the woods and there must be a critter in the yard. I'm sorry.
We also have some patient satisfaction, accessibility. There's also one, we have a QI, which track children who are referred to a podiatrist, if I said that right, Another where we are working on crash cart checks, and then also empanelment and billing from Laverne. And then Shavana says patient satisfaction. So a lot of patient satisfaction. Just curious how you, if a surveyor wanted to ask more about that patient satisfaction, how would you explain that project?
Yeah, and actually, Lana, that's a good point with all of these questions. So these are kind of those fundamental questions they ask everybody. But with any one of them, they might dig in a little bit deeper. They might ask questions like Alana just asked, like, you know, tell me a little bit more about that. Tell me some specifics about that. So being prepared to answer some of those deeper questions is always a really good idea as well. We have slowed down a little bit on some of the responses. So Jonathan, if you can click to the next question. All right, this is key.
There was a request from Barbara. She asked, can anyone share their patient satisfaction survey? I assume just like the template that they use. Anybody's willing to reach out to Barbara and share that with her.
Okay, and we can, oh, Ben has responded. I was gonna say exactly that, Ben, that I'm pretty sure there are some resources that are available on the IHS quality portal. And likewise, if you are willing to share, that's a great place for you to share your resources as well. All right, our next question is really applicable, obviously, in this time of COVID. What do you do to prevent the spread of infections? And it looks like we got answers coming in on that one already.
We have annual infection control training. The official OMB approved form is there. Oh, sorry, that was Ben's just response there. Amanda says ongoing precaution education in inpatient units and robust surveillance program. Barbara has monitor hand hygiene. Shavana, hand hygiene observations, secret shoppers. I've seen secret shoppers quite a bit. It actually works really well. I think, I guess, in my perception. Training and prevention from Laura.
Great, good answers. Jonathan, let's go to the next question. All right, if you saw something unsafe, what would you do?
And it's really good to practice these things because sometimes, you know, I'm a nurse by trade. If you walk out of, you're just walking out of a patient room and a surveyor comes up to you and you're kind of taken off guard a little bit, to be able to like have this conversation with one of your coworkers. So you're not like, I know what I do, but this is like, you're coming at me. So practicing with each other. Stop the unsafe practice and evaluate and educate. Intervene. Step up and say something about it right away to your supervisor or anyone that is there. And then Ben is sharing some more documents. Equipment, lockout, tag, and notify. I think that was one of the projects. Jolene, tell my supervisor immediately if it is something I can correct, make the correction. And Shavana says just in time training if needed. Amanda, ensure patient safety, notify anyone in the area, call appropriate department program to assist follow-up with iStar.
Yes, good answers. I like these.
Yes.
Reporting into iStar, great.
Yep. Try to fix a problem on the spot, report in iStar and to department supervisor, assist patient, report to supervisor. I think you got all, you guys are doing very well.
Yeah, good. All right, let's go to the next question, Jonathan. All right. Similar to the one above, but what would you do in the case of an emergency? So sometimes they ask about like weather emergencies, tornadoes, blizzards, you know, those kinds of things. But what would you do in the case of an emergency?
Follow the emergency, yep. Emergency plan, dial emergency line. Follow policy and procedure established by organization and or department. Report, refer to policy, and what's COOP? That's an acronym I'm not familiar with. Follow policy and procedures. Does the CEO call incident command? Question mark.
Can, yeah.
Yep. Activate ICS team. Patient, staff safety, all hands on deck as appropriate to the situation. Incident command ? Debrief after. I like that you put that debrief after, Amanda. Follow your policy and procedure for your service unit. Continuation of operation plan. We have an emergency preparedness plan that would be activated.
All right, great. This last one is sort of related to some of the answers you were already providing, but Jonathan, if you can click one more time. How do you know that's what you should do?
That's to refer to the emergency, Carrie.
Well, really to anything. How do you know what you're supposed to do? They like to be really vague with their questions and see where it goes.
Yeah.
Excellent. Policy and procedure. Yeah, some folks responded before, following our plans, following our documentation, our policies. I like this comment too about being confident with answering the question. Great. Good. So let's just pause a minute here and have a little discussion about, like, how did that feel? So I know, again, I'm not standing in front of you, and some of you might be in roles where you're feeling a little more prepared and familiar with the survey process, but how does it feel? Did it make you feel nervous or put on the spot? Were you nervous you were going to answer wrong? Could you think of an answer for each of these questions? And then also, can you see how practicing this with your staff, even if it's just practicing these 5 basic questions, might be helpful to help others feel prepared when a surveyor is on site? Does anyone want to be brave and unmute?
We could play Zoom roulette and just call out somebody. I'm a favorite of that. I felt I could, yeah.
Good. That's great.
Mhm.
I see too, practicing and doing drills. That's great. Good.
This is Amanda in Pine Ridge. Can you hear me?
We can.
Oh, okay. I feel like these answers are kind of fun right now. But as soon as the surveyors get here, I always get nervous. Doesn't matter how many times I've gone through it.
I think you're exactly right. As many times as we do something, it always gives you the butterflies when you're right in the moment. For example, right before this session, as many webinars and Zoom calls and things that I've been on, I still always get those butterflies. And I think that's a good thing to acknowledge for your frontline staff too, to say, you know, even I get nervous and this, it's okay. But here's some canned responses and some things that we can practice to make you feel a little bit better the next time they're here.
Elwood said, I kind of felt like I wanted to be the one called on, like I wanted to be the one to answer. That's good.
Yeah.
Yeah.
That's really good. That is a good sign of preparedness and practice, I'm sure. All right, Jonathan, let's move on to the next slide. This slide just contains a few more resources, some sample mock surveys that include staff interview questions. One of them is from the Joint Commission themselves. It's about their safety culture assessment. And there's a couple other resources in here that can be really helpful that I thought I just wanted to include if you wanted to check those out. You can, of course, create your own set of questions or practice amongst each other and share questions that way. I think the more you practice, the better everyone is going to feel when the surveyors do show up. All right, Jonathan, let's go to the next slide. Here are a couple of additional resources and links. The first one here is one I mentioned earlier, our PATH Accreditation and Certification Preparation Activity Guideline. Kind of a mouthful, but it's a really good tool that maps you through that whole 3-year survey cycle. So some of the activities and things that you should be doing as you're preparing for accreditation or certification in the spirit of continuous preparedness. And then a couple of resources from Joint Commission as well. They have a pathway to accreditation in an ebook form, and they also have some online curriculum that is available. So again, I recommend checking out some of those additional resources. And with that, let's go to the next slide. And since we're right at 2:30, Jonathan, let's actually skip to the next slide and we'll come back to the discussion after we do a couple of housekeeping items first. As I mentioned, this is one session in a series. So if you are available and interested, please join us next week for our discussion on how all of these accreditation standards and the regulations are related to each other. Allison is going to walk us through a crosswalk tool that can kind of help map out how all of those things are related. And next slide. And just before we move into our open discussion session, thanks again for attending and for your attention and your participation. I was very excited to see that you guys were all ready to chat in your responses. And Alana is going to drop in a feedback assessment link. And so we would really appreciate it if after we're done with our open discussion, if you could click on that link and provide some feedback for us. It's super helpful as we're designing these huddle series and sessions. Make sure we're meeting your needs. And with that, let's go one more slide and open it up for discussion. So again, this can now be anything about anything we just talked about or anything else related to accreditation or certification.
I have a question. This is Lauren Parker. I was wondering, I got on, this is my first time on this series, but we're going to be going through our accreditation survey with AAAHC in September. How do I get the first three information from the first three sessions you had?
Great question. Alana, I don't know if you have it handy, but we do have this huddle series recordings available on the PATH website, the Comagine PATH website. So Alana will drop that link in. There are recordings to this accreditation huddle series. There are also a few other resources on that page that you might be interested in as well.
Oh, great.
And Carrie, this is Becky Laverne. I'm going to jump in and say I will shoot you a message right now. And if you want to send me your email, I can make sure that you get all the slide decks and other content that might be helpful.
Oh, great. I'll put it in the chat right now.
Thanks. Great question. Just one more shout out to Veronica. Thank you so much for your courage and your willingness to share your resource and to speak, be one of our speakers today. I really appreciate it. And I love hearing from you guys and giving you the opportunity to share some of your promising practices and resources with each other. So thanks, Veronica.
Thank you. Thank you all for having me.
I just wanted to let you know that we did have a very good infection control consultant who came to our clinic and did kind of a little tour and gave us some advice. When you asked the infection control question, I got a phone call, so I wasn't able to respond, but she said when you're asked what infection control activities are you doing, you could mention, she mentioned doing an ICRA, which is an infection control risk assessment if you're doing any kind of construction within your facility.
Yes.
And to also mention if you're doing, if you're taking care of central lines, patients coming in with central lines, you do the you go to AHRQ and look at their little, they have little bundles, education bundles that you can use with your staff on central line, preventing central line infections and catheter related infections. So I thought, wow, that's very good. And, you know, to give us those resources.
Yeah, you know, that's a really good point, because just in general, you know, I know we just spent the last half hour talking about surveyors and people being nervous about giving the right answer and those kinds of things. But in my experience, surveyors, they really do want to share the resources, and they like to brag about the best practices and the things they've seen in other facilities. And so I think that's a really key message for your staff as you're doing this communication and the practice, is that they really are here. They're not here to call you out and to give you a fine and a ticket saying this is how you're doing things wrong. Though, yes, they do that too. But they really are there for the same reasons you are, to ensure that we are providing safe and high quality care to the patients. And they're great resources. They're the ones that are out there and they see this every day, everywhere. And so I encourage you even to take the opportunity to pick their brains a little bit. And when you're in some of the debrief discussions with them, to ask them, you know, what have you seen? What would you recommend in this area? Those kinds of things, because they more often than not are willing to share.
I agree. We did get a call from our AAAHC surveyor, and she sent us several tools, and and she said, just feel free to ask any questions you have. So, you know, they are willing to share and teach you, and they want you to be successful.
Yeah, exactly. Yeah, great point. Thanks for bringing that up. I'm just looking at chat again to see if there are any other questions coming through. I see some folks with emails. Becky is going to follow up, make sure that everyone has the huddle resources and that link to our recording. So thank you, Becky, for following up on that. We've got time left.
This is Kimberlyn Tom from Navajo area office. I just wanted to share, of course, we have a Navajo area accreditation team with some subject matter experts. I would say probably about 6 individuals. And all of our service units are getting ready for, you know, hospital surveys, laboratory surveys. So this was actually, we just completed for all facilities, including all of our healthcare clinics, or, you know, off satellite clinics. We visited pretty much every facility. It was a good prep for the service units, because, you know, coming back from, you know, of course, where everyone was all engaged, you know, addressing the pandemic, and now, you know, to make that transition back to focus back on accreditation. So it was good for all the service units, and even, of course, the all of our subject matter experts completing the reviews. We do the same approach, of course, as Joint Commission surveys, and it's, I mean, we've got really good feedback. Of course, there was a lot of areas of improvements at each of the facilities. And on top of that, each reviewers were able, of course, to educate staff, if not just frontline staff, supervisors, even up to our leadership as well. So there are items that we would like, are of course, completing all of our mock surveys. At each of the facility, there are some things that we would like to address, of course, with leadership, or anything that pertains to infection control, anything that, of course, with environment of care. So we're going to that phase now, since we just completed the service. But like I said, it was pretty much re-engaging all of our service units to say, okay, we still cannot forget about accreditation. And of course, we still have to, you know, transition back to this, you know, even though, yes, pandemic, it doesn't mean, yes, but they put things on hold, but yeah, we still have to complete these things for when survey does arrive. But it was a good prep, I guess you could say. And of course, just to get service back online again.
Yeah, thank you so much for sharing that. A couple of really good points that you made. The practice that you have within your area of having that accreditation kind of mock survey team is super helpful. So I bet there are others, if you are interested in reaching out to Kimberlyn for more information about that, I'm sure people would be eager to hear a little bit more about that process within your area. But not only establishing that process, but then to your point of sharing the learning across the facilities. So that is another thing that is super important within your areas and well, really across IHS altogether to say, hey, everyone, we just had this survey. Here's what they found. Here's what they specifically were looking at or focusing in on this go round, and sharing that with kind of like I was talking about with the command center approach, to be able to share that in real time, because likely if they just left your facility, they're heading to another IHS facility in the next couple weeks or couple months. And so making sure that we're sharing that across our network, so that, again, the surveyors, when they find a finding, they go to the next place and they see it's been addressed or it's been fixed and it's not an issue in the next facility that they're checking out. Great, good point. Thank you so much for sharing.
I have one more question, Carrie.
Yeah.
We're just now moving to the patient-centered medical home model.
Yes.
And if anyone has any brochures they could share with me, I'd appreciate it. We're trying to develop a patient informational brochure on what it is, what a patient-centered medical home is. So I would like some examples that we could pull from that you've all used in your areas. Appreciate it.
Yeah, thank you so much for bringing that up. So I know this is your first session, but one of our previous week's sessions was around PCMH, and that provided like a gap analysis tool for your facility as you're working towards that, which might be helpful for you. But also, I believe on the quality portal, there are resources there and examples that can be shared, and we will do a little bit of research and follow up on that for next week's session. Make sure that we can point you in the right direction for some of those examples for that patient facing. I think if I'm understanding your question correctly, you're looking for the patient facing informational brochure.
Yes, thank you.
Yeah.
I found a video, which is great, but I didn't find any kind of brochure, patient education brochures.
Yeah, and actually in chat, it looks like someone is willing to share. She entered her email, and I'm sorry, is it Rachel? Rachel or Rochelle? Rachel?
It's Rachel.
Rachel, hi. Hi, Rachel. Thank you for being willing to share that brochure.
Yes, thank you, Rachel.
All right, we got 2 minutes left. Any other questions?
Carrie, this is Becky again. I just wanted to note that Rachel, I may reach out to you as well to see if I could get a copy of that brochure, because if you're comfortable with it, I'd like to share it with others that have the same request. So I'll follow up with you after this huddle.
I just added it to the chat.
Awesome.
I didn't realize I could do that. So
Yeah, it's great.
Perfect. Thank you.
So it is in Publisher. So if I need to convert it to a PDF file, we can do that.
Great. Thank you so much.
Yep.
All right, we'll hang on this last 1 minute, see if there's any last questions that come in. Yes, Alana, thank you so much for reminding me. Hope everyone has a great holiday and that everyone gets a little bit of time off in this summertime long weekend. And Thank you again for joining and for all of your participation and for sharing your resources. It's so appreciated.
Thanks, everyone. See you next week.